It's May 21st. That it, you think? You want to do it? Okay, we'll call and we'll open the meeting at 6:32. How's that? That's nice,
Me.
right?
that.
Okay, we'll do, call for public participation.
No one's on Zoom.
Yeah,
It's just Jonathan.
Yep.
just Jonathan, okay, Rosie at 6:33. And can we, did everybody see the minutes from the meeting of April 30th? Any concerns, any corrections or anything?
I'd make a motion to approve the minutes from April 30th as written.
Second the motion. Okay, all in favor?
Linehan, aye.
And Silver eye. Okay, we can proceed on. I guess, will you explain the agreement for the
Yes.
Public Health Excellence Grant?
Yes. So you are familiar with it because you were interim director when this grant was in place. But for everybody else, the Public Health Excellence Grant is a 6-community grant. It's public health excellence, so it focuses specifically on staff training, standardization, especially for inspectors, for nurses. It's really to support all of our local health departments in kind of standardizing our operations. And so it's been around since fiscal year 2021. Wakefield was the original fiscal agent back in 2021. We held the grant here. We administered the grant for 6 communities. So it's Melrose, Wakefield, and Stoneham, Malden, Medford, and Winchester. We are one collaborative, across the state, many other towns and cities grouped together to make these collaboratives. And so we're able to share resources. We're able to pay for trainings. It's supposed to help bolster all of our cities and towns infrastructure, with the lens of health equity in mind, meaning that the belief is that all communities, large or small, across Massachusetts should be able to provide the same level of service to its residents. This has been going since fiscal year 2021. In 2023, the fiscal agent shifted to the city of Melrose, but none of the participating communities changed, so we're still in the same group. Over the last 5 years, we've able to establish specific positions. So we have a regional public health nurse position, an epidemiologist, shared inspector, health inspector trainees, and a communications specialist. These positions benefit all of our towns. They're able to cover when there's vacancies, when there's additional need. And we're able to also pay for things like translation services, supplies, and other training resources for all of our towns. And this,
We used it to purchase the brand new CPR equipment.
yes, we were able to purchase.
To share.
Yes, and we've also, this grant has also allowed us to turn out the very successful training program that we've been working on with new health inspectors over the last 5 years. This program has turned out 4 very successful inspectors. All of them have gone on to full-time positions as health inspectors, starting from a very small base of knowledge, but we're able to train them. This grant has always come with no match required, no town contribution required, so it has not come at a cost to any of the towns participating. So there's really been nothing but upside to this grant. The reason we are putting this intermunicipal agreement before the board is because the Department of Public Health at the state level has required that all cities and towns that participate in these grants to form a formal advisory board to oversee the administration of the grant. Up to this point, it's always been the health directors from each town that basically oversee the administration of the grant. This will just formalize that agreement between all the towns. So functionally, nothing will change after this is signed, but this will establish a formal body that will consist of myself for the 3 towns and the other health directors in the other 3 towns that participate in this. So we will continue to have this grant through fiscal year 2027 at this time. So June of 2027 is the expected end date for the grant. Unless there is an extension, which we strongly believe there will be from the state level. If they renew our grant, then that would be great. We can continue to carry out the functions of the grant. So, are there any questions?
I haven't seen the grant or couldn't find information about it on the website.
Yeah.
Is there backup information that?
So we have a separate Mystic Valley Health website. So I can get the link to you guys after the meeting. So the Mystic Valley website actually houses all our public health excellence information because it's kind of the 6 towns. So what we could do is we could actually link that website to our town page. So that would make it easier to find actually. But yeah, so that's where we kind of post, things that we've worked on. As part of the grant, we work on communications, communication materials. So we work on rodent communications, we work on, general environmental health things. We have them translated to different languages. So those are shared resources that we use across all the towns to try and be more uniform in the communication. So those are things you might find on our website. So I'll have that linked to our town website after.
Okay.
It was a very confusing grant when it first came up.
Yes, this grant has, I didn't mention it, but this grant has undergone many changes since the beginning. There used to be a focus on shared animal control duties across these cities and towns because it was hard to find animal control. Then they shifted their priorities to more like health inspections related, and standardizing inspectors, which was kind of where it landed. So now we're in that spot where the focus is on environmental health. The state has really developed a much more robust system now to train inspectors. They have a 3-tier system that includes, theoretical learning as well as in the field training. But this has taken place over the last 5 years. So now there's more kind of direction on the public health excellence grant. So when Elaine was interim director, it was kind of up to the cities and towns to kind of figure out what they needed. But the state has really come down and tried to help us kind of all organize around specific issues. So.
It's a good grant because it is a really good backup for, especially where we have that little Mystic Valley Coalition. So if you've got a city or town that's got a problem, an inspector out, a nurse out or something, or they need help, but they could have a big, huge emergency with something, like if we had a huge fire or a huge breakout or a water boil, you know what I mean? We could then pull from another city or town and take, those inspectors and those people that were needed and they could help with a backup, which comes in handy. Let me tell you, been there, done that. And it's not easy if you're the only one there.
So you can think about it almost as like mutual aid in that sense, like fire and police have, we would also help out in a case, and we have helped out in a case where other cities and towns may have unforeseen vacancies or emergencies. We have helped out with that. So the total amount for this year was 561,000 roughly, split across the 6 towns. I can send out this memo again so you guys can see that, or we'll attach it to the minutes as well. But this is the memo I wrote for town council. The requirement for the intermunicipal agreement is that the town council authorizes the town administrator to sign off on it, and then the boards of health locally also sign off on it as well.
So did the backup and the actual grant grow before the town council?
Yes, it went before the council Monday night.
Okay, so we could possibly find it there.
I'm sorry.
We could possibly find the backup there, you're gonna.
Oh, no, oh, I'm sorry, this did, I can give you the copy today. So this is just this is kind of like a backstory of all the things we've worked on. And then we also have the website that I'll send, that has more of the information.
Done tremendous work with this grant.
Yeah, so this,
Used to.
yes, so this memo was provided to the town council, which I can give to you guys tonight. Yeah, and it'll kind of detail things that we've worked on, the total amount of money that is granted this year, and what we expect in the following years, so.
Mhm.
And this formal body that's being formed through this intermunicipal agreement will then have to follow all the same rules, the open meeting law. So we'll post all of our meetings. We generally meet monthly. So we'll, same thing, we'll require quorum, we'll have minutes posted, agendas. We haven't had one official yet after this agreement. We haven't signed the agreement yet, but once we do, we will have all those posted and everything.
And all 6 communities are supporting, right?
Yes, correct. All the other communities have signed. We're in various stages of getting approval, but all the communities have at least verbally agreed to sign the agreement. It's just a matter of logistics now to get them.
Any questions?
No,
So
it
that-
seems just like a formality.
Yeah.
So that's
This-
Melrose, Wakefield, Reading.
Melrose, Wakefield, Stone,
Stoneham.
and then Malden, Medford, Winchester.
Thank you.
And I'll give this to you after the meeting. This has the list and everything listed on it. So.
Those basically are the towns that during COVID, when we had our COVID clinics, those were the ones that we served in the communities for the big COVID clinics, and they sent us a lot of help,
Yes.
a lot of support, a lot of ones. I have no problem with supporting it.
Yeah,
You
it
take
makes
a
sense.
vote.
Yeah.
You okay? Candace?
I'd make a motion to sign the agreement as outlined in that memo to form an advisory board.
Do you second it or you?
I'm in support of, very much in support of other communities coming together to, help each other, but I cannot sign something I haven't seen. That feels like not correct to me, so I just need to see it. So I don't think you need my vote per se, but I just would like to see.
Would it be just a unanimous vote if,
It
I think it usually is just.
it'd be a simple majority. But yeah, we can also send you after the meeting, send you all the.
It's a lot of reading. To be
Yeah,
honest.
I don't mind.
And it's a lot, and it's a little
Yeah.
difficult if you don't understand it, give it to him, but it's
Yeah.
basically just tells you that this is this money and it's all divided up and this is what you're gonna use it for, and nobody uses it for anything else. It's a very strict grant. DPH writes a grant like that,
Okay.
you gotta follow the rules.
Are
Like,
there
you don't get the money.
conditions on it or,
So the conditions are, whenever we have an expenditure, that the towns have agreed upon, we have to then run that by the Department of Public Health at the state level. They either say yes or no. They've given us guidelines on what to spend it on. But not specific, like, specifically on this, it's an area. So like, if we ask them, can we spend this money on staffing for a shared health inspector? We would go to them and say, would this be okay? They would either say yes or no, or they ask us more questions. Once they give us the approval, then the host city or town would then hire that person on behalf of the communities. Another example could be like MHOA. MHOA is our yearly conference that we go to for professional development reasons, for CEU maintenance. So we would normally, we don't have to now because we go every year, but we would go to the Department of Public Health and say, we have this conference we want to go to. Would you support paying for the travel, paying for the conference fees, that sort of thing? And they would approve us to do that. And then we would then get reimbursed for the conference. So
It saves the cities and towns a little bit of money and allows them to expand services or give to their residents the services that they deserve to have. And they have the money and it's fully funded from DPH, so it doesn't come back to us. And will Melrose be the host again?
Melrose will continue to be the host unless we have any specific needs to change. Melrose has been the host for 2 years now. It's fiscal year.
So they'll watch over it, they'll manage it, and anything we have to do with it, we just go through them and they'll submit.
So just to explain, so the fiscal agent generally receives, it'll be in the memo that we give you guys, but there's a 15% administration fee that's given to the fiscal agent that hosts the grant, because there's additional duties like HR related things, so posting positions, payroll for processing payroll, additional duties that are borne upon the town that holds it. So they receive the 15% administration fee to basically compensate for the work that's extra on top of the grant. So the other communities don't have to do that because they don't host the grant. So Melrose took it on 2 years ago and continues to be, but if there needs to be a change, we can discuss that as well. So what I'll do right now is I'll send you guys the full detailed agreement with this memo. So if you want to review,
Do you want us to hold off? I mean, I would second the motion.
so the only thing that if this gets held up, so they require us to sign this before they disperse Q4 essentially funds. So we do have staff that are reliant upon this funding to continue. So it would be helpful for us if this could be signed at this meeting.
I would second her motion, and then all in favor, Linehan, and you want to abstain?
Yeah, I'm just, gonna,
Okay,
I just, because I haven't seen it, it feels off to me to vote for something I haven't seen.
Sure.
I'm just familiar with it.
Yeah, of course, yeah, it makes sense. I wish I'd seen this, before today.
It's probably one of the only grants you'll ever see us really truly vote on, only because it's fairly new since 2020, and it involves us, in, like you said, in grants, this grant also pays the salaries of people we have, whether it be an inspector or a nurse or something like that, or the supplies, like we say, CPR supplies are huge. They're big, big money. And there's something that had to be replaced because they've upgraded them all. I'm a CPR instructor. I can't afford to get the new stuff. It's ridiculous. You'd have to teach it every single day in order to, do it. So, so you have a majority, you have two of us, so it's okay if we sign it?
That's
Is
correct.
that me that signs it? It's the chair.
Yes, you would sign it as the chair. And I just sent it so you guys can look at the meeting if needed, so.
I did look for it, I just couldn't locate it, so,
We're fine,
so
yeah.
to understand it better.
Your paper.
Thank you.
And next to vote on the advisory board member in the backup. Okay.
So this is just related to the Public Health Excellence Grant. So because we are going to be like a public body, that we're gonna be voting on things, just like the Board of Health, we would need to vote in the member that represents the three communities. I currently represent Melrose, Wakefield, and Stoneham as the health director. Medford, Malden, and Winchester each have their own health directors, so they represent their communities. So I would just need to be formally appointed as the representative for the communities, which I've been serving as. And then DPH recommends that we also have a backup just in case I can't make a meeting, then we have someone that also attends the meetings on our behalf. I would suggest Maureen Busby, and the board can vote on if they approve that, deny that. Maureen Busby, you guys might have met her. She came to a meeting. She's a regional tobacco inspector. She covers actually all 6 of our communities plus Reading. So it's a little bit of a different group, different grants, but I think her familiarity with many of the things that we do. She's been around for 10+ years. She knows a lot about the public health field. So I think she would be a good backup person in the event that I can't make a meeting. So. That's okay.
So this vote is to make you the advisory member.
Correct, yes. And then also appoint a backup person in case I can't make a meeting.
I think that makes sense.
Yeah.
I would make a motion to vote for Anthony to be the advisory board member with Maureen to be our backup member.
I second
Okay, all in favor?
Linehan, aye.
that. Hi, Macaulay.
And me, Silva. So moved. Congratulations. Now you have the advisor and
Continue doing the same thing.
Committee.
you are not here, Maureen.
You-
We volunteered you. Okay, we're ready for the health direct. Do you want, is she speaking? Or first, or
Do you have anything that you wanted to present to the board?
Well, I was just going to go ahead and say that Wakefield was very quiet, flu, and
I had 2 patients with COVID today. That I
really,
haven't had people with COVID for a while.
Wow.
2 patients with COVID.
Oh,
wow.
And both of them had never had it before, which was nuts. Yeah.
That's the same.
Sorry to interrupt. That was.
That's
fresh.
okay.
That's a good
But
one to watch.
we're seeing more tick activity. And so Lyme disease, there was one Lyme disease, in Melrose, I had a babesiosis and an anaplasmosis case.
Yeah, we are seeing tick related disease.
When is
Activity.
the spray happening?
It's not tick.
It takes out mosquitoes.
Only for mosquitoes.
Doesn't do tick?
No,
There's unfortunately no evidence-based kind of tick sprays, but
Ticks, you gotta get your tick puller and watch for
I mean,
it.
DEET is supposed to offer something, right?
DEET does, yeah. So we usually suggest DEET, well,
No.
we do suggest DEET on more equipment. We don't really advise putting it on.
Yeah, he's got
Right.
your
Skin.
clothing, yeah. Okay.
and then the other thing was Sandy has worked very hard on developing a Narcan training to give to all the employees in Wakefield. And so we did the preliminary kickoff training at the senior center and had 7 or 8 people attend that. And we had the CPR dummies and we did rescue breathing to teach that. And so that was very positive. And we're setting up trainings for the on other dates for other, and it'll be in here in this room. So there's 2 other dates set up. Once all of the departments are trained, then we will hang the Narcan boxes, and they will be located along with the AEDs in the town buildings. And
That'll work.
yeah,
It is.
and one other thing that I think is really pretty spectacular. Sandy had the help of one of the senior work-off people who is a pharmacist, and together they developed an over-the-counter drug interaction training to give to seniors. And so Sandy gave the first one, and I'm trying to develop a library so it's available to all 3 of our communities so that we can each share it along with doing, other trainings as well. So those are pretty spectacular things that I think are going on.
Great.
Great work.
We sort of touched on it in the beginning, but I wanted to make sure it was included in the meeting. Melissa Lowry was the recipient of an award at the Massachusetts Public Health Nurse Conference.
Miller Award.
The person who gave her the award happens to be Elaine, so
It wasn't, it was submitted by someone else, and it was, it really told of Melissa and how she came to us by volunteering and got sucked up in the vacuum, so to speak. Fell in love with public health and came forward and the work she's done, and not only coming in and doing 2 communities, but to take on a 3rd community and to come in her first week by herself with the interim director and have the biggest uptake in COVID that week. It was not our favorite week, but it was a very well-deserved award, and many people were amazed at what I got to read about her. We actually read it, so we were very, very proud.
Thank
The
you.
Northeast chapter was extremely proud that she had gotten that.
Congratulations, Melissa. That's wonderful.
Yeah.
Thank you, Jonathan.
nothing that hasn't already been said, but a privilege to work with Melissa every day. Looks out for the health of all of our communities and all our residents. So thank you, Melissa. And I think we've done introductions, but we'll do a formal one here. Anna is our newest administrative assistant here with the department, so
Yeah.
welcome.
Oh,
We're very happy to have you. Yeah, I know the board's excited to have a new staff member join us. Anna will be with us for all of our meetings. Yeah, we look forward to working with you.
Yes.
well,
Thank you so much. I'm very excited.
And Anna's actually familiar with the town. You actually used to work for the DPW.
Yes.
So we're very excited that she decided to stay with us in the town, so. And Anna learned a lot in this is second week now, right?
Yes, second week.
It's only her second week, and she's learned a lot in a very short amount of time. So yeah, we're very excited. So
welcome aboard. I imagine Dan trained you, right?
He's probably so happy to hand that
Yeah.
responsibility back.
he didn't say it out loud. I can see it in his eyes.
Yeah.
Okay.
No, yeah.
Did notice that the agenda online showed draft but yours doesn't, so. I don't
Yes,
know.
so there was a mistake, and that was also on my part. I sent in a draft agenda. It's the
Okay.
final, but
Oh,
the
good,
watermark
okay.
got left on it, so I'm gonna have it changed. Yes.
That was the confusion of whether or not we were here too.
Yeah, so I'm very happy that Anna's here because I'm clearly not great at the administrative portion of it. So,
As techie as you think it is.
no. But yeah, so that's basically it.
Do you want to mention Dan and Shelby?
Oh,
Oh, yeah.
yes, I don't know why I forgot. So, the natural transition would be, so Dan Thompson is now the senior inspector, for the region. Aaron Carleo, left the position, so now Dan is the senior inspector, so he will be covering the 3 communities, along with myself and Melissa. His first day was Monday, so he's been taking on a lot of cases. So hopefully
That's like right out of one role and.
out of 2 roles,
Yeah, right.
2 roles into
What?
one, but yes, it's been a good transition. He's really, I think it's great that there's some continuity in the position. He knows the staff, he knows of the cases that are ongoing. So yes, Dan has stepped into that role. And with his departure, we are actually going to be filling his position here with Shelby. Shelby Procchio is actually a health inspector trainee under this public health excellence grant. She's with Wells just over a year now. She started out with kind of limited knowledge. That's how this training program works. We just have people who are interested in public health kind of get into the field. But over the course of the year, Shelby has learned so much. She has turned into a wonderful inspector. She has done a lot of inspections for all 6 communities, including Wakefield, over the last year. So we are very excited for her to join our team here in Wakefield. So
And congratulations to Dan on his graduation with his master's in public.
yes,
Yes.
Dan graduated, I believe, this last weekend. Yes,
Sunday.
last weekend,
He graduated from BU.
Wonderful.
Yeah, yeah,
master's in public health. So
They have a wonderful program.
yeah, they
do.
do.
And now he's gonna look to go to nursing school.
Yes.
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 Do it, Dan,
Yes,
in all your free time.
all the
Go
time.
for it.
Yeah.
Go for it.
Yep. So very, very exciting.
Yeah, that's great.
Okay.
Thank you for the reminder, Melissa.
Yeah.
But yes, so we also, just to mention, we also had Wake Up annual meeting on Tuesday morning. We had Wake Up annual meeting. So Wake Up's the Coalition for Substance Use Prevention and Mental Health. This is Liz Parsons' first year organizing it. And Madhu, our prevention and wellness coordinator, was also part of it. And Sandra, our social services coordinator, they worked together to put this on. Great attendance. We had a lot of different partners show up. We had teachers, and the youth were very exciting. They were able to showcase all the work they've done over the past year. And they also gave out a couple awards. Our very own Amy Chiarabalati, who actually left us to go become a health teacher at the Galvin, she received an award as a trusted adult.
Great.
She's been doing great work with our kids, and the youth action team has really stepped up this year. So we were very excited to kind of celebrate their work as well. So yeah, the annual meeting took place. We also gave Steve Mayo an award for community service. Steve is retiring as of July 3rd, and over the course of the 17 years he's been here, he's been very supportive of all the efforts in substance use prevention in our department. So his support made it possible for us to have this coalition today. So he received a well-deserved community award.
It's nice. He's honored.
That's it.
Mhm. That's it?
Yeah.
Nobody else has anything else?
Oh, we can go on now.
Must be
You
something.
know, I do have a quick question on, and now that you're on board, I know you have a lot to learn. But at our last meeting, Leslie Scott Leeson asked about posted minutes going back to some time since they've been posted. Will that fall under?
Yes, so we hit a bit of a snag. I'm not sure what the disconnect was, because there was a time like right before Cindy left and between now with Anna starting. I don't know what happened. Some of those, they're all approved because you guys have been going through that, but I'm not sure why they weren't posted. So I'll take a look at it and make sure like all the old ones are posted. I have all the final versions of everything. I just don't know.
Yeah,
Posted. So we'll make sure all the agenda.
like if someone's specifically looking for them, you know, I.
Yeah. And we've been able to send people who have been requesting them the full versions. I just
Good.
gotta figure out how to, I don't know why they weren't posted.
Yeah.
But they will fall
Yes.
fall under this duty as well.
It was nice when they were sent out like a couple of days before the meeting. I don't know if that would be possible again. That was like a helpful review when we're prepared to approve them.
Yeah, and I think it'd be helpful for you guys, for setting the agenda to know what was discussed last time.
Right.
So
Yeah.
we'll have those,
Yes, if I could have reached, you know, well, that's actually about the agenda, but yeah.
Right.
Should reach out to you today, perhaps babysitting the toddler, so.
A lot of multitasking. So
Oh, well, my excuse was I just retired again for the second time. so I didn't go back on. I made everything on Monday. That was it for me. We also have a chore to complete tonight, in which the chair of the board, I have to go back down to the thing.
Sure.
Unless there's nobody that will do it. I just got voted in for something because no one would step up to the plate for something, but it's my turn to step down now. Serve my next 3 years till my next time, so I believe Candace, it's your turn. It's up to you. If you don't want it, it's okay. You don't have to. It's okay. We understand. We don't know.
I'm okay taking it.
Really twisted her arm there.
So I will
gonna cost one banana bread.
I don't make banana bread, I make good eggplant, Mom.
Cool, yeah.
Okay, there you go.
As long as it's kindergarten.
Yeah.
I'd be happy to take over. Be a hard act to follow.
And then that will make her vice chair, and that will make me what they call
Yeah, I was curious about that because we have a,
Yeah, we
yes,
have.
not a secretary, a person who supports the entire
That's why
team, yeah.
you see how I take notes everywhere, because one time I came to a meeting and I had a notebook this high, and I went back 6 months to a meeting to find something.
Oh, wow.
Laura was going nuts, like, I know, I got it, here it is, I go. So I do, but that's it. So, and then next year, it will be you that will step in. So this way you get a couple of years to kind of to take a look at it. It's not a bad position, so.
Thank you.
Yeah, oh, I have to close the meeting officially, right? Is
You're,
that-
you're fine.
Well, before you close the meeting, maybe someone should take a motion
To-
to reorganize.
To
To
reorganize.
appoint Candace, and
I
then
think this,
I make a
Maybe
motion to
Marcy's too.
reorganize and appoint Candace as chair, Board of Health.
I'll second that.
I'll accept the nomination and
Okay.
I'll,
And all in favor?
I, Macaulay.
I, Silva.
Linehan, I.
And I so moved, so she will become the new chair. I will make sure that I will send an email tomorrow. I think it's me.
Yeah.
I'll just send her an email tomorrow just to let her know.
Do I have to go get sworn in again?
No.
No.
No, only
unless you want me.
when I went to get sworn in this time, would you believe that from 3 years ago, my name was here on this side and I signed my name on that side right across from me. Isn't that weird?
How it all lined up.
Yeah, yeah, 13 years on this side. Let's see how many years ago on that side. I'm not promising people, but I will try. I won't see if I can break a record, I guess. I don't know. Well, that's it. Is there anything else? And I think we all should say to Anthony, congratulations. And
you.
we're hoping that your wedding will be a beautiful day. We know it will. And we do expect pictures.
Yes,
We
absolutely.
do expect them, and then you will be back, and then you will be gone again for your honeymoon.
Yes.
But we wish you the best on that day, you and your
Thank you.
lovely fiance, who's a very, very nice person.
Good luck.
And good luck. We wish you the best.
It's so exciting.
Okay, yeah, it is. It's exciting.
Would you guys like to set the next meeting?
Well, yes, I will be glad to set the next meeting, and I don't know if you will be here for the next meeting.
I
Am I
will,
correct?
I might not be here.
Be the 18th.
I will likely.
That's not a-
It's
Not
might
a
not be-
great night.
Yeah, because of the. all
It's the
schools
last day of
stuff.
school.
Yeah.
It's- Mm.
Yeah.
Oh,
I have that last day
late
of
this year.
Yeah.
Maybe not.
Better than Beverly. They're.
No, that's true. Yeah. Oh,
You want to?
no one's later than Beverly.
I
You
could
want to
do-
postpone it to the 26th? You want to keep it on a Wednesday? And I bet you're back that week on the 20th.
No, I'm only back until July.
You're out.
It doesn't matter.
Yeah,
Yeah, so it doesn't matter. Yeah.
yeah.
I mean, either week.
Is that okay for
Yeah.
everyone? Is that the weekend, like right before the?
Melissa will be here. I think Dan will be here.
No, it's not really the weekend before the 4th, isn't until the 4th, well, after that. So we could do, that would be June 25th. Am I correct?
I
Mhm.
think that's correct.
That would be okay. Yeah, that would be, that's the fourth Wednesday in
Yeah.
June, but
Right.
And then you guys plan on skipping July, is that right?
Yes.
Okay, so yeah, that was quick. Okay.
Every year, also please.
That's exciting.
a little summer
Yeah,
vacation.
you need
yeah.
it. And in July, with all the stuff changing in the fiscal year, you're better off waiting till everything is right in its place, that all the ducks are in a row.
And I'm sure we are not the only board that takes a little break.
No, many take June, July, and August.
Okay, so 25th,
25 June.
June.
25th of June, and then you guys will set the next date, but it'll likely be an August date.
Okay, so can we have a motion to close?
Make a motion to close the meeting.
I second the motion, close.
All in favor?
I, Macaulay.
Linehan, I.
And Silver Eye, so closed at 7:06 PM. Ah.